Um, for our third speaker, Mr. Robert Neil Leong. Okay, he's also Robert, like our first speaker.
Yes.
He's a PhD student in the School of Public Health and Community Medicine of the University of New South Wales, Australia. His thesis is on economic evaluation of alternative vaccination strategies against pertussis in Australia. So he's a statistician by training. He obtained his BS and MS degree at De La Salle University from the Mathematics and Statistics Department. Robert is a biomathematician, biostatistician, mathematical epidemiologist, and economic evaluation specialist. He already has at least 10 Scopus Index international journals, and he has experience on processing and analyzing large longitudinal health-centric data sets and electronic medical records and developing statistical, mathematical, and economic models applied to policy and intervention analysis. So currently, he's actually actively involved in some COVID initiatives such as Leads for Health, Security and Resilience Consortium, and the World Health Organization Regional Office as a contributor to measuring epidemiological metrics. Without further ado, let's all give a virtual clap to Mr. Wala, hindi pa siya.
Yes. Hindi pa po. Yes, anyway, I am now sharing my screen. I hope you can hear me well and you can see my screen. Okay, so just a bit of a background. This work is part of the technical advisory working group that my supervisors are involved in, providing technical assistance to the WHO Western Pacific Regional Office in their pandemic response, especially against COVID, and in particular working for the countries Cambodia, Malaysia, and Philippines. But I personally is only involved in one particular aspect, which is on RT, basically estimation of the effective reproduction number, which I will tell more a bit about later, and specifically only for Malaysia and Philippines. So yes, so essentially this talk will be about more about demonstrating what tools we can use, or what is the tool that we are currently using and how we are trying to develop it to better produce or nowcast, in other words, nowcast and hopefully later on forecast RT in the context of measuring the effectiveness of NPIs, which in our case are only lockdowns in controlling COVID-19, and just showing Philippines as our case study. So before I start into that, okay, so why is it not moving? There you go. So before I start into that, just special thanks to all the all the groups that we have been involved, or I've been asked to who have been collaborating with us. With special mention to Lynn and Laila of the WHO Philippine Country Office, who has been our data custodian, who has been supplying us line list data, although a little bit late, but at least it's on a fortnightly basis, and especially the Leads consortium, which I am part in, from which I've gained a lot of insights just by hearing the conversations, exchanges, and everything. So yeah, as mentioned, I think there's not much more that I need to there's not much background that I need to talk about COVID, because that's already been tackled by both Robert and John Frederick in their earlier talks. So basically, what I would just want to show here is that this is a snapshot of, or rather, a snapshot uh, of one of the things that is available in the Leads website, which I have listed below, and that we have been monitoring for the Philippines, which is here what you will see are the case numbers, or the confirmed case numbers, as well as the number of deaths. Rather the active and the confirmed cases, rather, sorry. So this is taken 7 days before, when I was starting to prepare these slides. So one thing that stands out here, and as of yesterday, if I'm not mistaken, we have already, or at least Philippines nationally has already surpassed the 80,000 mark of confirmed cases in total since the beginning of this epidemic. So what do I want to highlight about this? So if you would see in this graph, there have been particular measures. There have been particular key date. There are key dates wherein we try to implement certain measures to try to contain the spread of this virus, beginning with an enhanced community quarantine, and supposedly when mass testing has started, and little by little relaxation of these or lifting of these uh, lockdown restrictions. But despite all these, we are still seeing market increase, not just an increase in the number of cases, but rather also an acceleration, at least in the tail end, an acceleration in the number of confirmed cases that we're having. So basically that brings the question about how effective are these lockdowns, essentially, despite having one of the longest lockdowns in the world, why are we still seeing increases in cases? So that is what we are trying to answer in this particular project. And in particular, not the entire Philippine region is put in the same level of community quarantine at a certain given time. Actually, it is varying across different regions, across different cities, municipalities, GUs, etc. And this is a table that is provided to us by the WHO country office in the Philippines as of 30th June. And obviously, this has been updated. I think last would have been 15th of July. But bottom line is, while it's not surprising to see that the restrictive more restrictive restrictions are in place only for those regions which has highest numbers of cases. Uh, One thing that also stands out is that these regions or these cities are mostly urban or highly urbanized. So that goes back to the question: how do we assess, or at least how do we have an idea of how effective these lockdowns are? So one thing that really gained one measure, epidemiologic measure that really gained interest all throughout this pandemic is the reproduction number or not. And obviously, if you are to translate this into a real-time indicator, we, it is your effective reproduction number, or we would term RT. So just how do we define RT first? So RT is clearly defined as your estimated number of new infections caused by an infectious individual in a population where there are already other people who are not susceptible, who are no longer susceptible. So that is the key difference with the basic reproduction number or not. So given this terminology, so in principle, this should be useful, at least in providing insight into the level of transmission and changes in transmission in potentially near real time, because this is the indicator that follows the number of cases as they come in on a, well, it can be on a daily basis. But however, while while that while this RT is estimated based only on cases data, obviously, this relies on the quality of the cases, or rather the reported cases data, which we know have some inherent biases. Which, for instance, one thing that is apparent with COVID-19 is that there has been delay in infection and in onset of symptoms, and then further reporting delays, which is your right censoring or truncation. And from time to time, you will also be missing out reporting of cases. And in the cases data, you will not be able to reflect, or you will not be able to see which of these cases are artificial, which could have been brought about by increased testing capacity or contact tracing, for instance, and or is an actual increase in cases due to more active transmission. And obviously, one thing about the reproduction, one thing about RT, if you are interested only in measuring local spread or community spread, you have to isolate out imported cases. So that is what we tried to do in this project. Now, take note that that what we have now is by no means compared to a more comprehensive compendium of RT statistics that is already developed or currently being developed and updated on a day-to-day basis by Dr. Peter Cayton and his team, including Mr. John Hill Sarmiento, uh, his team with UP. I think it's UP and COV. They've been producing daily statistics of part of which is the RT estimation, but it is based on EPIESTIM. And it is comprehensive in the sense that it covers a lot of LGUs. So this is by no means uh, this is by no means replacing that, but rather what we would want to highlight here is that how we can use EpiNow, uh, EpiNow, which is also based on EPIESTIM, but with some improvements, especially in trying to incorporate the delay in diagnosis and the reporting delays, and from which we can right then and there separate out imported from local cases, by which not only RT is estimated here, but rather uh, it can also, as part of its summary table, it also gives us the rate of spread, which in turn is converted into doubling time, etc. Now, some of the assumptions that we have to make here is that first, the default serial interval is used as well, which and the prior estimate for R naught is also set, basically the same as with what you have with EPIESTIM. And just to let you know, since this was, I have prepared this slides, I think, a week ago. The latest available data provided to us, line list data, by line list, it is actually individual listing of the data with as much as possible. I think more than half of them had uh, the actual onset date, etc., etc., provided to us by our data custodians from the WIPRO office and DOH office would be the 5th of July. So it has been more than 3 weeks since, and we're expecting that new data will come in by the end of the week. And one thing to do is that as in any RT estimation methodology, it is assumed that case counts are actually more or less complete and they are reflective of the incidence trends. Now, one thing about estimating RT is that we are hampered by minimum number of cases or the case limits that we have to have in the last 7 days before a robust estimates are provided. So not only that we must have sufficient cases over time, but rather we should have sufficient cases over the last 7 days to have been recorded for this to work. So now, why 7 days? It is because EPIESTIM is using a 7-day window for the RT estimation. Now, one thing about EPI now, as I mentioned, is that it automatically adjusts for the reporting delay by using a delay distribution function, which is derived from your line list data. So if your line list data, as we have as I have reported here using our latest data available, has now a median reporting delay of 10 days. So what essentially happened is that any RT estimate for any particular day is back at the data was, well, for that particular data. So for instance, so that is the reason why, if you will see later in my plots, even if latest data available was for 5th of July, it the RT estimated for that date is actually reflective of the conditions 10 days before, which is 25th or 26th of July. So essentially what we're doing here is that we are producing nowcasts to 10 days prior to the latest date of data, and then from that date, we are essentially conducting forecasts up to a further 14 days after 5th of July. So that's also one thing about EPI now. Based on a TBATS model and ARIMA models, they are producing forecasts of the RT, from which after forecasting RT, they will use the RT forecast to forecast what would have been the number of confirmed cases moving forward. But we haven't explored much yet of these forecasting yet, so I won't be able to talk about it as much. So to demonstrate, this is what we have for the Philippines in general. So as you would see, from when we first started with this epidemic, I think early in March, In fact, early March, it is not surprising to see that our RT is more or less from an high of, actually it's about close to the R naught value of 2.2, and from since on, when the ECQ was first implemented, I think 15th of March, at least for the National Capital Region and many of the regions surrounding NCR, it has taken RT down to levels around 1. But it is not surprising to see that, because of when by late June and even until now, actually, we are seeing an average of 2,000 confirmed cases every day, which is higher than what has been happening before the last week of June. It is not surprising to see that RT, or at least our estimates of RT, will be above 1. Oh, just to give you an idea, just to give you more details on this, the RT values are in this panel plot B, while the panel plot A on the left is your confirmed daily confirmed cases, and the line plots and the shaded regions are the estimated values coming from the EpiNow package, and the gray plots are your forecast. So the middle block solid line is your median, rather mean estimate, while the darker green shade is your 50% credible interval. Yes, credible interval, because they are based on the Bayesian framework, and the lighter green shaded region will be your 90% credible interval. So this is for the Philippines. And in comparison to EPIESTIM, which is the more commonly used tool today, it's not surprising to see that we have essentially the same, more or less the same shape, except that with EPI now, it is much more smoothed. And one thing that you would notice here is that if uh, estimates of EPI now is shifted to the left compared to EPIESTIM, just because of that reporting delay that we have introduced. So what does it mean? So it is not surprising to see that, say, what EPIESTIM estimates as for today is actually EPINOW's more or less estimate 10 days before, because of the fact that we're using a 10-day reporting delay as our, rather 10-day median reporting delay as our now casting date. Now, one other thing about Epi now compared to EPIESTIM that you would notice is that with EPIESTIM we have tighter intervals, because while Epi now has, well, wider intervals, per, prob- perhaps suggesting there are more uncertainties in our estimates, just because with Epi now we are also considering, what do you call this? Considering uncertainties brought about by the reporting delay function. So that's the thing. But essentially, they tell the same picture, except for aside from the numbers being different. If we just focus on the qualitative interpretation of these numbers, rather qualitative interpretation of these plots, they essentially tell us the same thing. So going further down, we can also conduct estimations by regional or subnational levels. Here we have it for Manila, Metro Manila. And as you can see, it essentially tells us almost the same picture as that of the national estimates. Not surprising, because I think more than 50% of the confirmed cases nationwide is from Metro Manila. And in fact, part of EPI now is that it is able to provide you these plots where it has an estimate, a probability estimate of which cities or LGUs, whatever, have been experiencing increasing, or would have likely been increasing, or maybe decreasing in the certain number of cases based on the distribution of their RT as we have estimated. So it appeared here that Quezon City would be one of the highest back then. Back then, we have estimated Quezon City to be one of the cities to have been experiencing, or more likely to experience, increased number of cases, so on and so forth. And we can also do the same thing for some regions, and I have included here some regions which are of particular interest during the time that we're doing this, because we're seeing increases in these regions. So for example, region 4A, the Cavite, Laguna, Batangas, Rizal, and Quezon province. Um, while at some point when they already when early on it appeared that they are not experiencing sufficient transmission, COVID-19 transmission, but lately, due to increased cases as well, uh, we have seen spikes in a rather increase rather in their RTs, and of particular concern is the Central Visayas region, which includes Cebu, wherein at some point it has now experienced RTs significantly greater than one, in particular Cebu City. At some point, I think in around mid or to late May, which would have influenced, which we think have influenced the decision to have the city revert back to an ECQ, I think by mid June. So what does all these tell us? Um, in our technical report, what we actually mentioned there is that based on these measures, it appeared that initial lockdowns have successfully mitigated the exponential growth of the epidemic early on. Let me reiterate that it is early on, or in other words, it has in some ways, it was able to slow down the growth of the epidemic, especially by April or May, something like that. And with RT hovering around one, why are we able to say this? It is because RT has hovered around one, which more or less led to more stable case numbers. However, with RT increasing just even slightly above one, it may lead to large case numbers, as we have seen in the more recent days in the data that we have in the regions that we have plotted for, just because of this operating under exponential growth. So given that it is experiencing exponential growth, even just an increase of say from 1 to 1.05 or 1 to 1.10, you are expected to see almost, I think, doubling, or not really doubling, but almost 10 to 20% increase in cases as well. Now, so what do these tell us? Bottom line is, while we were able to successfully mitigate the exponential growth, these have not been sufficient to entirely eliminate the infection or even prevent regional spread outside of Metro Manila. But take note, we should exercise caution in interpreting these numbers, because what I have pointed out a while ago is that this does not reflect yet testing testing capacity or increase in testing capacity. And also caution that in all these RT estimation, they are by no means an absolute measure of the effect of lockdown, just because the model, or rather the RT estimation framework, was not really built, or was not really designed to describe and isolate only the effects of the lockdowns, and that because of time delays, or basically a distribution of time delays, would lead to cases being spread out over time, even when the intervention occurs. But the main takeaway from all of these is that we advise against premature lifting of restrictions. We can work about we can do this on a go about this on a day-to-day basis, and easing as we see fit. But basically, with premature lifting of restrictions, we are anticipating that cases will rise, especially in high-risk urban areas. So for future directions, one thing that I have noted a while ago is that this EPINOW framework, only works with sufficient sample size or sufficient number of cases. In fact, by default, what we're doing is that uh, we see that it's only able to produce robust estimates if we have 20 cases, 20 new confirmed cases over the span of the last 7 days for RT estimation to work, and further another 40 cases for forecast to work. So what happens if we have LGUs, or what happens if we have areas such as some most of the regions, if we go at subnational levels for Malaysia, what can we do now when the number of cases are declining? So one thing that we're currently doing is we're exploring a more advanced tool, which the website I have put here, which is estimating RT, but in the context of local transmission potential. So what does it mean? So when there is sufficient epidemic activity, this is similar to the RT that we have now. But in the absence of sufficient epidemic activity, what we are actually trying to do is that we're trying to put in some measures, like say mobility data, so on and so forth, for which we will try to project what would have been the RT had there been also what would have been RT based on these proxy measures, and measure basically the probability of transmission or your transmission potential. So that ends my talk. Thank you very much. And
Thank
yeah, I
you.
think I'm sorry. How
Um,
do
so,